Good morning, everyone. Thank you so much for joining. This is Huddle Up Moms 2020 Roanoke Postpartum and Pregnancy Resource Summit. Welcome. We're so excited to have you guys. So today we are joined with Kimmy Chernicki and Jay Azell. Thank you guys so much for coming.
Thanks so much for having me.
Jay, I know you're driving, so I'll kind of jump to the questions. So we're going to so this is kind of a coffee Q&A, meaning we wish that we could be all together and kind of sit in this round table and people can ask questions, but we have a number of questions from the community that people submitted beforehand. And so we'll kind of jump in and get started. And then if anybody joins and asks me any questions on the side, I can put them in there too. So both of you, do you want to just start, Kimmy, and tell me a little bit about what you do?
Sure. So I am a pediatric and prenatal chiropractor, and that is something that you don't just say you are. You go beyond school and do lots of seminars and training, and there's a board exam that you do. So, it's a pretty involved process. But we support moms all throughout pregnancy. I love starting even before conception so that we can set a good foundation for overall health. And then checking out babies once they're born is a really great way to start life. Make sure that their nervous system is working properly so they can have proper development. That's what I do every day.
Nice. Thank you so much. And Jay, do you want to talk a little bit about what you do for women in the community?
Sure. Hi. So my name is Jay Azell. I am a group class instructor at Brickhouse Health and Fitness in downtown Roanoke. I'm also one of our personal trainers there. And I also handle all of our client success stuff, just making sure that all of our members just feel at home and feel connected and really just see us as more than just a gym where you come and work out, that you are connected. And the fitness aspect is just that. It's just an aspect of what we do. And then I am also a independent associate with ID Life. So we partner with whoever we can. And as Dr. said, we love partnering with people really before, especially women in our community before they get pregnant, and just communicating through what does a healthier lifestyle look like, and starting that baseline so that as they go through pregnancy and they come through postpartum, just how they can stay consistent is something that we love to do, and just helping them on that journey and partnering with them from really start to finish.
That sounds great. Okay, Kimmy, the first question is for you that somebody messaged about. So what types of problems do you see in pregnancy that patients come in and see you specifically for? Like, when would a patient come and see you?
Yeah, so I will say that just kind of general statement, I think it's good for anyone to be getting checked and adjusted throughout their pregnancy, even with a lack of symptoms. So I'm pregnant right now myself. I don't really have anything going on, but I still get adjusted just to make sure everything's in alignment. I had a really awesome first birth, and I want to make sure that we do the same this time. That's the goal, right?
Yeah.
So I would say, most of our moms come in with there is something that's kind of driving them in, but ultimately their real goal is, I want to save healthy, easy, whatever that is. And so most of our moms, we do have, like pelvic and low back pain. And that kind of comes with the territory of your body changing so rapidly. And if things are out of alignment, it's very typical for things to become uncomfortable. So I want to make sure that moms are feeling comfortable through their pregnancy. And with that comes a better aligned pelvis, which should make the birth go quite a bit more smoothly. So that's one side of it. Another really common thing we see is sciatica in pregnancy. And that's something that we've been incredibly helpful with. We love helping moms along that journey. Let's see round ligament pain, pubic symphysis pain. Those are kind of some common things too. And then another one that we see is babies who are breech or otherwise not in the optimal head down position. It's not that we flip babies. We're not doing external cephalic versions like OBs might, but all we're doing is making sure that the pelvis and all the soft tissues of pregnancy are in the right position. They're not tight one way or another. And by doing that, that should allow baby to get into their optimal position, which isn't always head down, right? Because sometimes we have cords that are wrapped around necks. We have short cords, different things like that. So for some babies, it's not good for them to be head down. But all I do is make sure that the pelvis and all the soft tissues are doing what they're supposed to, so that if baby wants to be head down, they can do that.
I love that point. So I think, what you were saying about being comfortable in pregnancy, I think one of the common things that people come in with is saying, they didn't seek care because when they complained or quote unquote talked about it, someone said, oh, that's just normal. And it's normal in pregnancy not to feel good. Can you speak a little bit about that?
Oh my gosh, we get that all the time. And I get it, right? Because if you're not the one who's actually correcting the problem, sometimes it's hard to give them a tangible, like, oh, this is what you can do for it. But I'm here to tell you that you can be comfortable in pregnancy. I mean, of course, your belly is going to get giant and you're going to feel huge, right? I can't correct that. But if we can make sure that, because your body changes so rapidly, even just the curvature in your spine. So your belly goes forward, your upper back tends to do this. I mean, that's a very exaggerated, but that's how it makes up for it. And that's a lot of where that discomfort comes from. So if I can help you go through those changes gracefully without certain things getting tight over others, most of our moms they're way more comfortable than they would be without. One of my best testimonials we ever had, it was a mom who was on her third pregnancy, and she told me, she said, holy smokes, I feel better at 39 weeks in this pregnancy than I did at 15 weeks in my first pregnancy. Awesome. So, so I'm just here to tell you that you can be comfortable in pregnancy.
Yeah, that's awesome. All right, we'll switch gears just a little and then come back. I still have a couple more questions for you, Kimmy, based on the audience. Jay, I'm sure you get these questions all the time, but how do you do an assessment for a mom for how much she can work out in pregnancy? Like, is it based on trimester? Is it based on, her overall health? Like, if you have a mom that says, okay, I'm worried about gaining too much weight or not staying fit enough, what kind of do you start off with?
Yeah, so those are really great questions, and really it's both of those. So one thing that we do and that I really strive to focus on is that each person gets that individualized attention. There is no such thing as a one size fits all. So it's really, you have the new mom, whether it's a mom who just found out she's pregnant, or maybe she's a couple months into her pregnancy. Or even the same would be if she is several months postpartum and she's just trying to get back into the swing of a healthier lifestyle. Really, it really just starts with a conversation. We sit down together, we talk about, what did life look like pre-pregnancy, which helps kind of give me a baseline. Maybe it's someone who has done more of the CrossFit style, more functional fitness style of fitness. Maybe it's someone who she typically does like the Krav Maga, more high intensity interval. It just kind of helps me get a baseline of kind of who I'm speaking with, seeing where their mindset is. Like do that. Like for instance, my wife, who we've been kind of more the functional fitness style people for about 5 to 6 years now. Well, with our first pregnancy, she was able to do that same type of fitness pretty much all the way until birth, until we gave birth to firstborn. Well, now we just had our third child, who is 7 weeks old, and this pregnancy was completely different. As Dr. Kimmy just said, like, the same was true for us, that she felt better at 39 weeks in this pregnancy than she has in any of our previous 2. But her style of fitness completely changed. She was more walking every day in this pregnancy, doing more stretches, doing more yoga style fitness, and not doing the more functional fitness style. So each pregnancy is going to be different. Every mom is going to be different, but it really starts with the assessment of where are they, what is the background, what is their goal, I think is a very big, important question. What are they wanting to get out of their kind of their fitness while going through the journey of pregnancy, and just kind of understanding more about them. But then also, depending on where they're at in their pregnancy, will also determine kind of where the path that we take and what we do. So it could start with still doing more strength training, maybe having light dumbbells or actually having some resistance training. But as time progresses and they get further into their pregnancy, we may do the same type of workouts, but we may do away with the added strength components. So it really all changes, but it starts with that initial assessment. It starts with that initial conversation and just kind of listening to the mom. What I'm just there as kind of the facilitator. I'm not a boss. I'm really just someone there who is to support the mom where she wants to be and kind of how she wants to get there. Because a lot of times what we see is our folks and new moms, moms who are just trying to get back into it, but really across the board is sometimes we just need a little bit of accountability and just a little bit of wisdom, that added wisdom of someone who's going to be there beside you, helping you do it. And like your bodies as moms and women are incredible, and a lot of times you don't know what you can do, and that's what we want to help you understand is what you can do and what you can and really get out of it even during the journey. So it starts with the assessment, starts with the conversation, and then it can literally flow into whatever the mom wants it to be.
Yeah. Do you recommend that? So I'm sure, Kimmy, you get questions like this too all the time. We counsel patients in general about when they're pregnant. A lot of people all of a sudden want to start working out. And so they have their baseline is, and they think that if they start working out vigorously while pregnant, they won't gain too much weight and things like that. How do you, both of you, kind of counsel patients about weight gain and not even weight gain, but just kind of overall health and starting something kind of new?
Oh, I don't know. Jay wants to go first.
You go ahead.
So for us, we always talk about easing into it, easing into that fitness, because what we're taught is that what your body, for the most part, what your body has been used to prior to pregnancy, you should be okay to carry out for most of pregnancy, right? Yeah. That's not always the case. And I think that's why it's so important to work with a fitness professional who really knows their stuff, because they can assess your body. They can see if you have a diastasis that's starting to develop, and they can kind of say, hey, let's back off of that specific exercise, right? Which as a mom, you may not know how to, or you may not recognize it yourself. So I always tell people to start with a good fitness professional who actually knows their stuff about pregnancy. That's that. And as far as the weight gain, we talk about, typically you should be gaining this much weight throughout. But I don't know. I just try to tell my moms not to hyper focus on it. And I don't want them doing fitness for the purpose of like kind of tapering that weight gain.
Yeah.
The fitness should be to create a strong foundation for a strong, healthy baby and a healthy birth. That's what we talk about fitness for.
Okay.
Yeah. So, I thought, and she is absolutely correct, and that was exactly what I was going to say. What we always want to communicate to our people is, and we can still figure out the baseline. If we have a mom who comes in who, for 3, 4, however many years has not really been doing, we don't want to discourage them to saying, well, we don't really have a baseline. We wouldn't discourage them from starting. We can still figure it out. It just kind of, we're just starting the process at square one, but we don't ever recommend doing anything more than you are already capable of doing and anything that you've already been doing. So with that, especially inside of a gym facility and with a coach, a leader, or a fitness professional. The other thing that really plays into that is just the safety aspect. Like a lot of moms who, if you have a fitness background, kind of working out is really nothing abnormal to you. A lot of times that maybe that competitive nature edge just kind of comes out naturally. And so while you're working out, you don't really realize how hard you're going or how much effort that you're kind of expending. So having a coach there, having a personal trainer, having someone there whose job is to make sure that you stay safe, and also doing whatever movements you're doing correctly, I think is just incredibly important. I know for my wife, and I know I just use personal experience a lot. My wife is super competitive, crazy competitive. Doesn't let me win at anything. And one thing that has tended to happen is she'll be working out, and she'll start realizing that she's out of breath. And that may change. That may be from doing a workout. That may be walking on the treadmill. Like it fluctuates. But one thing that we want to communicate is whatever fitness routine that you are doing, we want you to always be able to carry on a conversation. And as long as your heart rate is to the level to where you can still have a normal conversation with me, then that tells me that you are staying in a safe place when it comes to your fitness. And for a lot of people, that's hard to focus on and maintain if you're by yourself, whether that's in your home setting, whether you're at a gym where it's just kind of you with headphones on. It's just hard to monitor that type of level. And I think that's where having someone beside you to where you can communicate with and who is sole purpose there is to make sure that you are staying safe in every way. I don't think that is, I think you can put a price on that type of care. So yeah, doing what you have already been doing and doing it safely is something that we communicate to our people.
That's great. And then the last question, so that way we can kind of wrap it up and talk a little bit about, preventative health and then postpartum. What types of preventative, recommendations do you make for pregnant women as far as, either protecting their pelvic floor or protecting because I know, some of the common, we joke all the time, but, the pregnancy walk, how actually truly bad it is for you, to sit back on your hips and kind of stick your belly out and waddle and things like that. What type of preventative discussions do you have with your clients or your patients? And then in the postpartum period, what is the recommendation for when you see them back?
So at our office, we, of course, I think chiropractic is a great preventative.
Yeah.
I'm obviously pretty biased there, but overall, just good for your health. We talk about a lot of the spinning babies exercises, which I love. They're great classes. I know Mandy Irby teaches some of the classes in the area, but they also have a lot of really great free resources on their website. I think it's just spinningbabies.com.
Yeah.
And you can go there's a drop down. It has like daily exercises, weekly exercises. That's a really, really great place to start. And a lot of the recommendations we give for moms in our office come straight from there. Yeah. Just being a lot more mindful of like you said, just how you're sitting, even not even necessarily your movements, but how you're sitting or lying down, things like that are really big. So we talked about that. And then as far as returning postpartum, did you mean specifically under our care?
Mm-hmm.
So under our care, we say as soon as you're ready. Like we've had some moms even stop by our office before they even get home from the hospital. So yeah. And of course we make modifications to what the adjustment looks like. But as most everyone who's listening to this knows, birth is not easy on either you or baby. A lot of changes happen to your pelvis. So we want to make sure that we help get that back in alignment, because the last thing you need while you are home with this brand new newborn is to be uncomfortable and for things to be out of alignment, and, especially sitting for long nursing sessions, things like that. I want my moms to be in perfect alignment so everything's functioning and moving properly.
Yeah, that's such a great point, because I think, we as healthcare providers really kind of emphasize the fact that, we see you at 6 weeks because that's how the healthcare system is set up. And so moms think that they can only see someone or even start like, walking or exercising, after 6 weeks or after 8 weeks, which isn't true. And so it's great that you're coming and telling everybody that you can come whenever you feel ready. And how about, what do you say, Jay, as far as getting back into the swing of fitness?
So yeah, so to start with, one thing that we communicating to all of our people, but especially moms to be, women who are thinking about getting pregnant, is that's where we feel it's so important to already set up just your life and just focusing on a healthy lifestyle, kind of setting yourself up for success before you even get to there. So really just practicing just good nutrition that I've spoke on, just kind of getting into the gym, but so much of a healthy pregnancy falls on a healthy nutrition. Fitness is important, absolutely. Good rest is important, absolutely. But so much of how moms will feel, how babies will respond, really falls back on good nutrition. One, as something that we've already touched on, that will also help in kind of when the medical provider, midwife, whoever kind of says, okay, we're kind of expecting this amount of weight gain. A lot of that doesn't ride on, well, how hard can you work out? A lot of that rides on what is your nutrition like and throughout this pregnancy. So one thing that we want to help our moms to be and our new moms kind of understand is, what does right nutrition look like? And then obviously you're going to have, I don't remember what my wife's cravings were this round. I think it was a bowl of cereal every night. I think. But like, obviously that's going to happen. That's life. And we never have, and we never will reach perfect nutrition. It's not sustainable. And honestly, like, it's just not practical. What we communicate is better choices, more consistent than not.
Yeah,
So
good
when
mantra.
you're making those better choices throughout your day, it flows into better choices throughout your week. That is how you will start seeing how much better you feel, and at the same time helping your baby at the same time. So really setting up a healthy lifestyle, even maybe before you get pregnant. If you are pregnant, then it's still flowing into that same thing of a healthy lifestyle between good rest, between good nutrition, and consistent fitness of some type. So to really try to go back and answer your question, so when it comes to kind of getting into it, but then also postpartum, we always want to really give it back to the medical professional. That's not our level of expertise, and we don't pretend like it did. So we want our moms and to really communicate well with their physician, through their midwife, whoever is on their team, so that they are comfortable and confident in what they're choosing to do. But what we say is, you know what? Just listen to your body. Your body is amazing, and it was designed to move. So just listen to your body. When your body starts telling you, you know what, you need to slow it down a little bit, then listen to it and slow it down, and acknowledge what is going on, what you've been doing for it to tell you to slow down and rest, and then do that. Just rest. Rest is part of the program, and it's vitally important. And a lot of times it gets skipped over, even when you're not pregnant. Even when you're not pregnant, a lot of people skip over that rest aspect. But it is just as crucial as working hard and being consistent in the gym, as being consistent in those rests outside of the gym. So really just listen to your body. And then when you are working out, again, listen to your body. Start slow. Make sure that you're in complete communication with your doctor and your physician, your midwife, letting them know what you're doing and how you're doing and how you're feeling when you're doing it. Because our bodies were designed to move. So I agree with you. Like, waiting 6 weeks, 8 weeks before you really do anything, I don't think is safe. I don't think is healthy for anyone, for you, for your physical health, or even your mental health. Um, just getting up, because we know, and I said it in my live recording the other day, like there's a direct correlation between gut health and mental health. And they
Yeah,
both
that's
kind
so
of flow
important.
into each other. So if you're taking care of the gut health and just moving and eating well and getting the rest, you will see those benefits when it comes to the physical health side of life.
Yeah.
But then we also, I think that's where the right vitamins and the right help comes from as well. So in ID Life, and we really focus on that individualized attention care. So moms to be, new moms postpartum, fueling your body is of the utmost importance. And we're just not big fans of kind of going into a box store or a grocery store to get something that is going to take care of our body or our baby. So we communicate you taking what's best for you and what you know is safe and effective for you, and just helping yourself, because we're not getting all of the nutrients that we need through our daily food. Even when we eat the best, food is just different these days. It's just the way it is. So getting that extra help to help you in your healthy lifestyle, we believe is just crucial.
All right, Jay, I'm so sorry. I hate to cut you off, but the session is ending. So I just wanted to say, so this concludes our Q&A for the community providers. We really appreciate both of you coming on. We also like to thank our sponsors, so Dr. Harding and Star Lactation with Catherine Havener, for their continued support, and for both of you for supporting Huddle Up Moms. We hope that you guys continue to participate in all the other sessions, and we thank you guys. We're going to we recorded this, so this will be available. Thanks so much. And hopefully, all the moms out there that are watching or that may be watching later, what we want to do is to provide you with enough education and resource to build your community. So you've heard this, half hour, how important it is to have either a chiropractor or, a fitness expert that is supporting you on your journey. So that way you can really thrive postpartum and really kind of live your best pregnancy, for you. So kind of think outside the box. It doesn't have to always just be, an OBGYN, or it doesn't, that's what this kind of session is all about, is really taking all the resources in the community and working all together so that you guys have a happy and healthy pregnancy. All right, guys, thank you so much. And we'll talk to you soon.
Thank you.
Bye.
Thank you so much. Have a great day.